Hello, everyone. Welcome to Artistically Married, where art and opportunity collide. We're your hosts, Jake Ackerman.
And Brianne Steinberg.
Yeah, and today we have Ernie Bagnulo, the owner of Win Health and our business neighbor.
Yeah.
Thank you very much for having me.
Great neighbor. Great neighbor to have.
We try.
Yeah, I always talk to people about it, just like how complimentary it is, right? I'm like, just, drop your kids off and go to Win.
Lotion, lotion.
Yeah, I love that.
Yeah.
Oh, we got to do like a partnership, lotion and motion.
Sounds good.
It's good. So I just wanted to kind of start off. I was doing some research this morning just about the chiropractic college and kind of everything it entails. I think it's really important for our listeners to understand the education that comes to having a journey like this and to become a chiropractor. So do you want to just kind of walk us through what your education journey looked like to become a chiropractor?
Sure.
It's hard to remember, eh?
Well, it was impactful. I can't.
It was a lot of years.
I can't say it was hard to forget, but it was, even though it was a few years ago now. So, I did a 4 years honors degree at University of Western Ontario, kinesiology, Bachelor of Science there. So that was, I did the long route by doing the honors degree, but it was something I really wanted to do, because I thought it would be helpful to have that Bachelor of Science background in kinesiology, where it was a little bit more quantitative versus qualitative. So for example, it was more, science-based versus like the physiologies, the anatomies, the biochemistries, versus something, say, more like the sport management or sociology of sport. That wasn't really what I was looking for. So from there, I then went to New York Chiropractic College, now called Northeastern College of Health Sciences, but it'll always be New York to me.
Yeah.
And that was a 3-year and a third degree. So it's a 10-semester program that rolls concurrently. So there's not really any time off. So you're there for 3 and a third years versus 4 with a summer off. And that was in the Finger Lakes in Seneca Falls, New York. And then the last 10 months or so of a residency internship was done just in Buffalo and Depew, New York. And then I was able to finish that and then go right into the working world and start to hone my art and skill, so to speak, in the way that I saw fit and the way that I envisioned the way, I wanted to practice as I started the journey of professional care and in chiropractic care.
Holy, so huge.
Yeah. So it was 7.5 years post university, but I mean, I was still 20. I wasn't even 27 when I graduated. So at the time you think it's an eternity. At the time you think it's, my God, this is never going to end. But what I wouldn't do to be 27 again.
Yeah, and I think it's really important. I think we're at a time, and I get this. I mean, it's such like a baby level, but I find that like now with the internet, it's really hard because people do a lot of like self-diagnosing and self-therapy, and I think it's really important for people to know like the education that goes behind all the
Absolutely.
all the therapies that you're offering at Win Health, so that they aren't doing things like that, like going online and thinking they can do the same thing.
Yeah, it's like, you can't watch a Superman movie and fly, right?
Right,
like
exactly. And I think until like people really get educated into like how much goes on behind the scenes, that I think it's really important that we are advocating for all these. And I think more than ever, we're really in need of these type of therapies for people. We're going to get into it, what you're seeing in the clinic and what I'm seeing in like the fitness world.
Sure.
I really think it's important that people understand the like professionalism that goes behind these techniques, so that they don't end up in a worse scenario by learning off the internet, right?
The chiropractic adjustment or manipulation is, it's a skilled art. It's a controlled act. It's regulated.
Right.
It's not anybody can just go around doing it. So there's a lot of skill that goes with it. There's a lot of practice, and you can hurt somebody if you do it wrong.
Exactly.
Or incorrectly. And there are instances where it's happened, and you have to have a judgment call of when it's not appropriate either, right? Because that happens just as much as the obvious of people thinking they're just going to come in to be adjusted. Well, sometimes it's not the right thing to do either, depending on the kind of clinical presentation. So it is a skill. There's an art, and that's kind of where the education
Yeah.
helps you. That's why you do it, right?
Yeah.
So don't let Uncle Larry crack your back at Christmas.
No, the bear hug and a thrust is not what we were taught.
I need my dad. This is specifically to my father. If Barry Steinberger is listening to this, stop cracking people.
I'm going to diverge quickly, and I do have this habit, but like,
Yeah.
I don't know if anybody if you guys saw the episode of The Simpsons when Homer's back hurts and he couldn't get it fixed. He went to every chiropractor, every physio. He falls on the garbage can, and then he's like,
God.
he has this like. He has this lineup of people who come to his house and he throws them over the garbage can one by one and they all get up and their backs fixed.
Oh my God.
And then this like police car full of chiropractors, like they call the chiropractic police, come after him and they're like, you're practicing without a license, you can't do this. And then it doesn't work. And all of a sudden his whole plan just gets kiboshed because it stops working. But it's hysterical.
Yeah, that's my dad throwing people over the garbage cans.
It worked on me, so it's got to work for everybody else,
exactly.
right? Yeah.
Oh my God, hilarious. Well, yeah, you've started just such an impressive business. I've been into the clinic a few times. So tell us kind of how you went from your education, starting to your practice, and then deciding that you were going to start Win Health.
Good question. So, when school finished, I was fortunate enough to gain an associateship where I learned a lot. So the first thing you have to do is kind of figure out how do you want to practice. Like, do you want to be, certain practice in this style or that style? It's not to say one is better, wrong, right, or less important than another, but you kind of got to figure out how you want to practice. And that's the whole point of these externships and kind of the clinical year of practice, hone your skill and figure out what you can envision yourself doing. So I was able to get an associateship in a local clinic where I was able to practice in a way that I saw fit for me. A lot of manual work, hands-on work, muscle work, active care. It wasn't traditional, so to speak, as far as chiropractic probably was maybe 20, 30, 40 years ago.
Just because of like your mentors, like who was working under?
Yes.
Okay, cool.
And I learned a lot. I saw a lot. I had some really good experiences where I was fortunate enough to give them the opportunity to travel, to treat some high-level athletes at the time, and really said, okay, this is how I want to do it. You think you want to do it, then when you actually do it, do you still want to do it? And the answer was yes.
And a lot of times you're evolving, right? You're like, I liked that, but I didn't like that.
Absolutely. And the whole 23-year career so far has been an evolution.
Right.
And, then the time came where, after about 3 years or just under, my wife is a naturopath, for those who don't know, and she was kind of had her own clinical practice on her own. And we were probably 29 at the time, and we're just deciding the plan was always to do something together. They were just too complementary. Power
couple.
Yeah. I mean, you may know about that. So we decided to take the plunge, and we just said, it's kind of now or never, knowing that potentially one day we'd want to start a family. So we wanted to get this part out of the way with. Mm-hmm. And we did that. And we originally started in just a small, 1, 2, 3, 4 room clinic, or as my wife, Laura Mola, naturopath, myself, we had a massage therapist, and it went really well. And it kind of just stayed that way for probably 2.5 years, and then be able to gain an associate, and then another associate over time. It's just things, we were blessed, we were fortunate, but we put our head down and kind of, you still have to work hard at it, right? It's as much as it's a healthcare industry, it was still a service oriented industry. So I think we worked hard at trying to make people happy, and we kind of grew the clinic from there. So it was originally called the Wellness Institute of Niagara, which is where the WIN acronym came from.
Oh, I was just going to ask that.
And then we kind of evolved into WIN Health and Rehab Center. We didn't love the word wellness anymore. Even that term seemed to evolve, where it became cliche around that time. A lot of wellness was being thrown around, and I just wasn't sure it jived with our kind of goal or our direction forward. Mm-hmm. And then we became WIN Health and Rehab Center, and then we're like, okay, that's okay. Now the word rehab has some other connotations that we didn't really want to, I know it's a rehab center as far as physical rehab, but and then we started integrating from physiotherapists, massage therapists, naturopaths. We thought, well, WIN Health Solutions, and then we became WIN Health Solutions. And then that kind of, again, evolution of the way. So we always kept the WIN acronym because that was kind of what people knew us as WIN Health. Yeah. And now it's just kind of WIN Health Performance Center. So it's a kind of an integrative name, but we've kept the WIN acronym. But that's where those three letters derive from.
I love that.
Yeah.
I didn't
And
actually
it had
know.
a bit of a positive connotation to it.
Yeah,
too, so.
exactly. That's what I was going to say. I didn't know what it stood for, but I was like, oh, it's just, winning at life, right? Like once you are making those like physical changes in yourself, when you're stuck at barriers, when you're changing and you're growing and you're kind of able to like recover from things like that, it's winning, right? You're like winning life at like, fixing things like that. So that's where I thought it came from. I love that. I love the name.
Yeah. So it worked as a kind of a double meaning.
Yeah.
Yeah, totally.
Yeah, I love it. And I love that, like, it's such a like holistic approach. Like I think people nowadays, they're so busy, right? So like they don't want, when you come to a place and like now you guys are probably able to see passing off clients, right? You're like, okay, I've taken you this far and now you really need to go see a naturopath to like figure out your eating, or you need to go figure, for some massage to like loosen up some muscles and then come back to me. So I think like a one-stop shop for people that are dealing with all these like physical situations, I think is great.
Yeah, absolutely. Excuse me. Absolutely. And that was kind of the vision. There's no one perfect practitioner for everybody. I think,
Right.
I sometimes I'll hear it and I'll be like, oh, so they told me I shouldn't see a chiropractor, or, oh, you shouldn't, what do you think? Should I go see my physiotherapist, or should I see, an osteopath? That's what I get. Or should I go see my doctor? And the answer is like, absolutely.
All of them.
Like everybody has kind of a piece of that spectrum.
Yeah.
My old family doctor was kind of that same mindset, which kind of really enlightened me at the time, because I was young. It was well before I was in my health education career. And, the spectrum of healthcare is exactly that. It's a spectrum. And I think having a, interdisciplinary clinic or multidisciplinary clinic, whatever term you choose to say, is appropriate. I think it's convenient. And I think if everybody can be on the same page as far as where their role lies, and everybody, you can stay in your lane with a little bit of crossover, but knowing what you do well, I think the spectrum is just a little bit more accessible for people, and a little bit more, there's less chance of error or hurting somebody or making a poor judgment call.
Yeah. And you touched on something I think that's like really powerful, which is, I'm not going to say it's like a competitive in nature, but you really do want the best interest of the client. So like for a client to get confusing mixed messages in the healthcare situation is just so difficult for them to figure out where to go next. And I do see a lot of people in the fitness industry where they'll get a mixed message. Someone will tell them this and someone will tell them that, and then they shut down,
right?
Because they don't know who to trust, right? So I think having a team together that like gives them all those opportunities is so much better. And then also there's something that like I don't understand, because I'm getting so involved in the tech part of like my business, that I'm like, how is this not on like a governmental level? How is there not reports that are crisscrossing? Oh, it's a privacy issue, but like, right? So I think when you're in a clinic like that, then the crossover just becomes part of the system.
Yeah, of course. And I'm not, maybe I'll need you to clarify what you mean by like government level. Like, are you talking about
our healthcare? Yeah, like our healthcare. Why isn't our report following us around? I've been in scenarios where they're like, oh, this isn't on your doctor record. And I'm like, how not?
I don't want to speak for the the side of things that I'm not really a part of, or I don't understand I'm not given every opportunity to understand all the policy and procedures on the medical
clinic
end, because that is definitely more, the rules are different. It's governed. It's funded provincially, right? So where we're a private healthcare sector, so it's certainly different. However, the patient is always in charge. Like, if you want something, your health record is yours, whether it's your medical doctor, your chiropractor, your physiotherapist, like, that health record is yours. So you may come to me and I don't know you from, Eve. And I may say, okay, it would be helpful if I can get this imaging report that you might have had that is at your family doctor's office. With a swipe of a pen and your signature authorizing it, we can send a fax over.
Right. Okay.
And that fax, then they can send us the report. So we can help facilitate some of that.
We're like requesting it almost.
Exactly. Yeah. But, I need what's appropriate for the condition you present with.
Right.
Sometimes I'll dig deeper than the patients even understand, because it is all appropriate. But I always just say, you're your own advocate, whether you're seeing your family doctor or a specialist that you only see once. So sometimes patients just don't know that they're entitled to having their access to their records. That doesn't mean they need to have them at home with them, because that doesn't serve a purpose, because some of the information they probably don't even understand.
Yeah.
But there's value in getting that information from the patient, and if they don't have it directly, then getting that from whatever health practitioner may have given them that information in the first place.
Right. And I'm just imagining though, like at a clinic like yours, where, you know, that maybe information is easier passed along.
Correct. And
right. So that person's file is
still
in your,
with the permission of the patient. I can't just go randomly look at your physiotherapy reports, right?
Yeah.
Those are still considered protected and private. So, you know, even within the clinic, you need to give me your permission to go look at your records of another practitioner.
Okay.
It's not just, it can't just be random.
Maybe it's just easier accessibility from like one practitioner to the other, right?
100%.
You're not trying to email another office to like tell them the information.
Absolutely.
If you get the permission, then it's just easier to look up for it.
Yeah.
And I feel like a lot of people are, you know, I don't care about my privacy. Please just treat me, right? Like make sure that I'm getting the right information to the right doctor, kind of thing. So yeah, I think that's powerful in a clinic where there is like cross therapies.
And that can happen with just on the table on the spot. Let's say, you know, Jake's on the table and Brianne's a physiotherapist now, and I can say, Jake, do I have your permission to bring in so-and-so to help take a look at this? So that, you know, maybe get their take on, you know, maybe they've seen something like that's where it's advantageous, right? As long as, you know, just, hey, another set of eyes can help, another set of hands can help.
They're in the other room sitting there. I can bring them in. Yeah.
And that's where the value of, you know, more eyes, more hands, more knowledge. It's everybody sees things differently.
Yeah.
Experience helps. Sometimes inexperience helps too, right? Not having a biased.
So do you guys do a lot of diagnosis, or do you typically get people reference from other doctors or something like that?
We do. We have the ability to diagnose. We can diagnose as chiropractors, but again, within our scope of practice. So it has to be a neuromusculoskeletal diagnosis, or diagnosis and treatment. It has to be related to the neuromuscular system. Now, that's broad in the sense that as long as it can be related to a deficiency of those systems, it's within your scope of practice to treat. But, you know, there are certain things that are not in that scope of practice. So, I mean, I'm just trying to think of something so off color that it's obvious. But like if someone is having, if someone is having issues with their stool, let's say colon issues, you need to have an evaluation of what's happening. Like if there's something happening there that is absolutely not what I'm going to help them with, because it's not a neuromuscular skeletal issue. It could be a gastrointestinal issue. You need to have the appropriate testing, because I may not be the right guy for you, and that would be irresponsible for me to think that I could help you just
I'll crack your back and you'll poop. Here we go. Or exactly it. Or that's probably even a better example. Yeah, I'm constipated. Can you help me?
But what if there's a blockage? What if there's something else? What if there's torsion? You know, we are trained to have that differential diagnosis.
Right.
And, you know, there's a certain criteria that it may or may not be, but you have to make the responsible decision and do what's in the patient's best interest. You can't think of, you know, not everything is just because you have a hammer, not everything is a nail too, right?
Yeah, and that's really hard, because you did go the route in your education to get all those like anatomy and physiology and science. So it must be hard for you to bite your tongue sometimes to be like, I know so much about this.
Well, no, we can tell them. For sure. We can say, listen, I think something might be going on here that's out of our scope of practice.
Yeah,
it's not like it's a secret, because that's not. But we say, you need to follow up with your primary care physician, because that person has the ability to order the proper diagnostics, do the proper evaluation, send you to the proper specialists, where we don't, and we need to get back into the government-funded system to do that.
Yeah.
So it's not so much of biting the tongue as much as saying you have to be careful. You know, I'm not going to go and spitball a diagnosis that I'm not doing on a daily basis or have been trained to do.
Right.
You stay within your lane.
Yeah,
right?
exactly.
Like, stay within our lane.
Yeah, because your college protects you for all those diagnostics.
Yes, it's. Yeah, let's just say yes. There's clear rules of what we can and cannot do.
Yeah, so, exactly. Yeah. This is a perfect prelude, because I just, when I was thinking about this talk with you, I think it ends up being such and we were saying, you know, kind of staying in your lane, but I think it just, because you're treating the whole person, it ends up being such impactful on the mental health. So you see these clients that are like, you know, I see it at the gym sometimes where typically it's, you know, with aging or injury or accident or trauma, and just the impact of a physical concern or physical, you know, issue causing so much mental health. Can you kind of speak to that and kind of what you see in the clinic?
Absolutely. I can think of case today, yesterday, the day before. Like take a case of a person who loves to run. There's someone who's run for 20, 30 years. All of a sudden their knee hurts, their ankles or their feet hurt, and they can't run, and they're going through all kinds of treatment and nothing's helping. The mental impact on that is huge. It's that outlet has been removed. So, they're coming to us to get help, to get back to doing something they love so that they can function in the world that they thrive in, or in a way that they thrive. Sorry. So, if that runner can't run, but they love to run, life is miserable for them. And, in the meantime, you try and give them at least something. Can you run less? Can you run, different terrain? Can you ride a bike?
Swim.
Can you swim?
Yeah.
That's right. You don't want to take away or remove and say, listen, do nothing, because
that's the worst thing.
That's a pitfall for sure. So it's working with that part, is working with the kind of the psyche of it all too. Again, not treating the mental component per se, but recognizing that you can help them by keeping their lifestyle active and creating an alternative route while you're trying to help them get better with whatever ailment that they might have at the time. So that part is huge. And there's been a shift. I mean, there's been a post-COVID shift. I don't think anybody will deny it, that, there's a real realization that healthcare, it matters. So the time you spend with a patient has changed. Their wants and needs have changed. And we've had to adapt to that too, because, if they're not getting a sense that you're valuing what they're telling you, that could impact the efficacy of the treatment too. Patients are there looking for a solution, and we have to give them, if not the one that they're looking for, at least the direction to push them so that they can find what they need. With giving them real answers, not fake answers, and just kind of making them happy but not telling them the truth. You have to still but the time of treatment has definitely changed the way we look at the patients, and really try to create a safe environment for them has changed. I would say that's the case too. So that part that's an adaptation over the last 4 or 5 years for sure.
I feel like they just feel so hopeless. Like, do you also feel like a therapist?
Oh, for sure. Bartenders, hairdressers,
exactly.
therapists. Absolutely. Chiropractors, exactly.
Right up there. They're laying on a bed in front of you.
Of course, there's a trust. I mean, they'll say, "Oh, who's a good chiropractor? One you can trust, or who's a good physiotherapist?" If you don't trust them, I think that's what matters the most too, because. There's certainly, the good chiropractor for Jake might be this person, for Brie it might be that person, for me it might be somebody else, but it's somebody you connect with and you trust, and you resonate with, and you feel comfortable to tell them, what's going on. So I think that's just an important part of healthcare, as the physical touch, the exercise, the nutrition. If you don't trust who's giving you the information, then that can certainly impact things as well.
I think it's that care part, right? Like knowing that, like, and that's a whole other question. I think that could be a whole podcast of caring so much. Right?
Yes.
I'm a bleeding heart. Like, these parents tell me stories, and I go home and I carry it. Like, I care so much that it's hard.
Like any extreme, right? Like too much water is no good.
Right.
So you have to carry that balance, and I think that's a journey for a lot of people. Well, no matter what they do for a living.
Totally.
Right? It's not about what I do for a living or what you do for a living. It's like, how do you balance work? How do you balance home? How do you balance being a parent? Right? Like,
totally.
The closer you are to that balance, probably the more grounded you are. But,
I think also there's probably the flip side where, the stories that you've had with like success and having people get back their mobility or become pain-free, or therapy works and they go through it, and kind of seeing that like mental health shift as well so fast that all of a sudden you give them their life back.
Absolutely. Like, I've seen it on many levels. I mean, just from physical ailments, but also from watching them just be down in the dumps because they said they couldn't even go for a walk. And then, back pain's a big one. I mean, obviously I'm a chiropractor. We see a lot of back pain. Like, the number of people that have walked in or crawled in and walked out, sometimes it happens right away. Sometimes it's just, or most times it's progressive. Right. But, over a week or 2 weeks, you're like, oh man, like, look at you. You got, you're walking again. Your mental capacity is better. You're not taking the medications just to get through the day. Those are those aren't wins for me. Those are wins for the patient, right? Because even as a practitioner, we don't fix people. Like people get better, right? Like we guide them. We try to be a catalyst to make it happen a little bit faster, right? But we're kind of just trying to push you in that direction to allow you to get your health back better, whether it's the manual therapy, the exercise. That's the mode we use to make it happen. But that word fix, it's always kind of like, ooh, that's a lot of pressure. I don't fix anybody, right? Like mechanics fix things. I'm a body mechanic, sure, but fix.
I love
it's
that.
like I don't know, like it's a tough word.
Yeah.
It's because you can come in with me with a meniscal tear in your knee and the cartilage of your knee, and I can get you back to walking, running, functioning, having no pain, but the meniscal tear is still there. Right. So that's where the word fix is a bit of a, got to be careful.
Yeah.
Right?
And I
adjust
think,
or tune up or something.
a tune up.
You're
I love
functionally
that.
better. You're stronger. And it's this kind of spectrum of the way things go. I don't want to turn your podcast into something different too, but I'm not sure if I'm taking it somewhere, but
no, I love it.
It's this whole, like we get better because you adapt, you get stronger, and you start to interact with that environment that you're around on a daily basis just a little bit more efficiently. So that's what I push kind of people off the cliff.
Yeah. Come on, you can do this.
But, you do the work. Like, when you're with me, you do the work after. I get you for a small period of time. I don't get you for 7 days a week.
Yeah, right? All day, every day. I think too, we are just in a time societally where like everyone you talk to is so busy, right? And like they're investing their time in whatever it is. I'm not judging that, but I think you're right. I think it's a big important thing, the take home message for people, that like you can only fix yourself,
For sure.
You have to take responsibility for your own wellness.
Oh, I have something. There was a great quote. I just saw it. I think I have it right here.
Oh, nice.
And
it's
from Hippocrates.
Oh.
Before you heal someone, ask him if he's willing to give up the things that made him sick in the first place.
Oh, I love that.
It's powerful.
Yeah, I love that.
Tread lightly, but it's a pretty powerful quote.
No, it's so powerful because you're right. A lot of times when you ask people to like list, what the reasonings, or you're giving them like the reasoning of what happened, a lot of times they're not willing to change, especially I'm sure your wife sees this so much in terms of the eating habits. Huge. People just refusing to give up these awful foods.
Huge. And you don't have to give it up forever entirely, but like, what are you willing to do to get to where you want to be? Right? Like anything, you can't turn into Arnold Schwarzenegger eating bonbons on a couch, right? You got to work hard. You got to do it, right? And I'm not saying I'm perfect. Trust me, I have my own vices too, but it's like, what's the sacrifice to get there? And I'm not talking about like blood, sweat, and tears. We're in a clinical setting, but you have to do the exercise. If you don't help yourself when I'm not with you, then that's hard. Right? That's hard to kind of get
they're
there.
just
and
assuming
the
that they're just coming in and that's going to fix it. So I think it's really important. That people are willing to do the work for themselves.
Absolutely.
So you kind of mentioned this, that you're in some of your like early clinical stuff, that you had the opportunity of working on athletes. I love both of those facets of your practice. What's the difference, in working with people that are just, everyday people? What's their typical situations? Why are they coming to you versus maybe athletes, and how do you train them differently?
So the difference as far as how we would treat them, as far as, the techniques, athletes have 2 legs, they put on their pants one leg at a time too, right? Everyone's human, everyone has a nervous system. Their nervous systems tend to already be trained, right? They've been training, so they're what we would call much more neuroadaptive. So they're going to be a faster responder usually, right? Because they tend to be more compliant, or else they wouldn't have been, they're not going to be an elite athlete in the first place. So they're not going to be somebody who's going to be lazy when they get home. They're going to do they're going to do what you told them,
responsibility.
Plus, right? But their nervous systems and their adaptive patterns they're already in place. So getting them back to where they want to be it's easier in the sense of they're going to get there. They're going to get there.
They're going to do the work,
but they're going to be on you more, right? They're going to make sure that you're like, well, are you sure this is the best thing? Like, I need this to be fast. Like, so they're going to be a little bit more nitpicky about things. They're going to know their body better. They know what they like, what they don't like, what's worked in the past. So
They're going to have spent 9 hours on Wikipedia studying their injury.
Yeah, maybe. Yeah, that could be part of it. But they know through, whether it's teammates, colleagues of their own who've gone through these injuries, they're well researched. They're very well educated as far as these, the type of injuries concerned, like with musculoskeletal injuries, if that's what we're talking about. So that would be and when I say athletes, I don't mean professional, always elite. I mean, even your marathon runner, your someone's going to be, race, mountain bike racing, road racing, skier, but someone who's trained, someone who does what they do well, right? That their body has adapted because they do something on a consistent enough basis. They know their body, and they're looking to get back fast. So there's that kind of pressure thing, like, hey doc, fix me. I'm like, oh, we'll get you to help yourself. But if you do it, we'll get there faster, right?
Yeah.
I'll do everything I can. So yeah, you might want to see them more often just to have your hands on them a little bit more.
Okay.
But that's the biggest difference is their expectation. You have to meet their expectation.
Right.
Yeah.
And then I guess counter to that is like, what's the typical things that you're seeing clients coming into the clinic, just everyday people that aren't athletic?
I mean, hey, low backs are huge, right? Low backs are
sitting here with low back pain right now.
They're bread and butter. I think whether you're a chiropractor or physiotherapist,
why are we
massage
seeing
therapist,
this so much?
Because we are in a forward stooped society, right?
Right.
Like, look at us now. We're sitting in chairs.
Yeah.
And then we do that through most of the day, and then we go and do yard work, or we go shovel a driveway, and that's the maladapted body that someone, like, if you shoveled a driveway all year long, used it, shovel to your left, shovel to your right, and adapted from a young age, you probably would tolerate doing that much better when you're 50 years old, because you've developed those neural patterns, right?
Yeah.
So those are the reasons I say low back, but that's what we see a lot of. But,
yeah.
I mean, 80% of, I don't know what the exact stat is, but somewhere between 70 and 80% of the population will have some sort of low back pain in their lifetime. Probably closer to 80 if I remember correctly, and that's a large amount of people.
Huge.
That's a large amount of people. So that doesn't mean it's going to be sciatic leg referral or discogenic pain where you're surgical. It just means it's going to hurt, and we're going to have to help you get back to the kind of pain-free lifestyle you're used to. But that's why we become maladapted. So that's the reason. And then you try to do something that you're not used to, and you do it on a repetitive basis in a short period of time.
Yeah. And I guess, that would be the trick with, everyday people, is trying to get them to do it all the time, right? Trying to do their exercises or
and
whatever you're trying to get them to do.
We're blessed. So this is in this private versus public healthcare system. We're blessed. Like, people, even if it's extended health insurance and benefits that cover their costs, we're blessed that people want to be there, right? Like, they're paying to be there.
Totally.
So I wouldn't say we get a lot of non-compliant. Again, there's that spectrum of the most compliant versus the least, but people want to get better. Like, we're not getting people that don't have any interest in their health. They're there because they want to be. So that's a positive of what we do, and that's part of what makes my life or my job so exciting too. Is if they're excited or happy to be here, then so am I.
Yeah,
right?
it's a good partnership versus like people that are like, man, I don't want to be here.
Correct.
Yeah. Oh, that's awesome. Yeah. So do you want to walk us through like some typical therapies? I was reading online. You had you have a whole bunch of things. I was like, how is this even like
cool things? Like,
so cool?
We are unique in that.
I was like, I thought it was just cracking. There's all these like lasers and shockwaves.
Oh, I feel like I'm in an Austin Powers movie.
That's what it sounded like. I was like, this is exciting.
Yeah,
I'm gonna go get some lasers.
Over the last, lasers were not commonplace 20 years ago at all.
Right.
They were expensive. They were, were they effective? Were they not effective? When I first started practice, they're divided into different classes. So class 3B laser would be considered a low level or a cold laser. Patients don't really feel it when it's on them. But the premise of healing is it's called photobiomodulation. So it's light energy that's converted to chemical energy at the cell level, and it promotes metabolism to happen faster, decrease inflammation, repair tissue. And then they were, more affordable. That's why they were bigger in the market at the time. And then class 4 lasers came in. So the I'm not going to say one's better than the other. One has a purpose versus another. They have their own purposes.
Because you use both, right?
We use class 4 now. We've migrated
Okay.
to class 4 because I just felt that for our needs, it was a little bit more effective, but I'm certainly not saying that class 3B isn't appropriate either, because there's times when the class 4 is not.
Right.
But I would always kind of give it the fire hose versus garden hose type of analogy, right? One's just massive flood of light, and one's just a little bit lower flow.
More localized? No.
Class 4 tends to be something you can control a little bit better, but I would say they're both pretty focal. Like they're not just these diverging lasers everywhere, but they're an aid, right? They're just like you need oil for your car engine to run. Like it's an aid for people to help us to get better, or to help them get better a little bit faster, and to work on the cellular level rather than just this, heavy touch all the time. But it brings a lot of blood flow to the area. That's essentially what laser therapy does. It stimulates a nitrous oxide, which is what somebody know as laughing gas. But that it doesn't make you laugh like laughing gas. It creates nitrous oxide in the body, which causes blood vessels to dilate, so you're getting an influx of blood to the area that
Amazing.
you laser. Yeah. So
is it a specific color light?
Laser it's an invisible near infrared type of light, but it's not. It's not something you would see. So a lot of times, when you see us utilizing it, you'll see a red dot on the patient, but that's more of a guiding beam. The laser itself is invisible.
Oh, okay.
And that's the reason we can be very precise with it. Class 4 lasers you feel heat with, so patients do perceive a sensation of soothing warmth, which I think is of value as well.
Totally. It's like same people as using like heating pads all the time, right?
There's always going to be that sensation of feel good with it. The heat itself is a byproduct of the metabolism that's happening at the cell level, but it's not you can, by the same token, you can burn somebody with a class 4 and not likely with a class 3, because if you hold it too long, that's one of the things you have to be worried about is I can burn the patient. So you got to make sure you're doing it on the right patient. You wouldn't use it on patients who have like cancers in the area. Obviously pregnancy is a big deal. Even open growth plates on some of the youth, like it's not, it's something that you'd have to be careful of. You don't want to be using it as every part of the treatment. Tattoos, they absorb the light. So hot, like dark tattoos, like black, green, blue, they heat up pretty quickly.
Oh my gosh.
Yeah, so they'll absorb the light. So those are some of the things to be careful about with laser as well, but it is highly effective as far as decreasing inflammation. But again, best used consistently. Like to say, to do laser once and say it didn't work, well, of course not. Like it's not a one-time fix. It's cumulative with the rest of it. It's an adjunct to the treatment that we're doing.
Right.
But that's just, anyways, I'm getting into this laser, but that's one of the adjuncts that we have. But it's also, I'm interested in being a little bit different than other clinics. Like everybody has a laser now, so I use it, but it's not like, what else can we do? Like, then shockwaves. Like then shockwaves were a big deal, and shockwaves were not commonplace. Now shockwaves are commonplace. So,
what's the difference between a laser and a shockwave?
A laser is light therapy.
Okay.
A shockwave is a physical form of therapy. So, and then within the shockwave world, there's radial, and then there's focus shockwave. This is kind of an exciting topic for me because a lot of clinics have radial shockwaves. It's a pneumatic air compressor that pushes a cartridge back and forth. Sounds like a jackhammer. The premise of it is to create a small disruption at the tissue level under the skin surface. Again, to bring an oxygen-rich environment through the trauma of basically traumatizing that tissue by smacking at it. But it's like a bullet that goes back and forth within a little jackhammer type of handle. Very heavy force, deep impact. And that's radial, meaning that it contacts the surface and the shockwave is divergent radially. It goes out into an outward pattern. So then there's focus, which we have at the Win Health Performance Center. And it is very deep, very precise. It is piezoelectric. So it's similar to the technology that you would see for shockwaves that were used for lithotripsy, breaking up kidney stones.
Okay.
So same company makes both machines, but this is much more. It's more depth, so it's deeper. It's a little bit more precise, a little bit more painful, but works really, really well when you're dealing with things like calcific tendonitis in the shoulders where there's calcium deposits, plantar fasciitis, jumper's knee, rotator cuff tendonitis, tennis elbows, like lateral epicondylitis, like all these type of injuries where the tendons are irritated does very, very well when you have the combination of those two therapies. And then you can use laser on top of that as well. Like you can combine them. But that's
I just picture like a meat tenderizer. I want it.
Maybe a little bit.
I want it.
Maybe. I mean, those aren't sexy terms per se.
Oh my God, it sounds amazing.
But again, those are things we've been using for probably the last, 12, 13 years.
That's amazing.
But, recently we've really, just before COVID, we really got into DC current therapy. So something called the newbie. So it's low voltage DC current, which works with the nervous system. It's an adaptive way of challenging someone. So there's a lot of potential with this, and there's a lot of things we can do with it. You can train on it. Like you can go to the gym and train on it, or you can do rehab with it. You can do what's called an autonomic reset, where you just want to recover and lay down and kind of create an electric meditation, so to speak.
Wow.
There's contraindications, no cancer, no pregnancy, pacemakers, implants. There's certain things that you can't do it with,
right?
Because it's a DC current. But it's one of those things that I joke with patients. I'm like, think of a police taser, but without the
gentle taser,
but it's low voltage, without the writhing and pain on the spot. It actually is a soothing sensation, because when people have it, it's like, oh, this is pretty cool. But what it is a way for you to actually move. So it's an active therapy, and you're allowing your brain. I can get really theoretical on this, so I'm going to try and simplify and be quick with it. But our brain, when we're in pain, the reason why we have pain is that it's a safety net, right? Like our brain perceives pain so that we don't do something on a repetitive basis that causes us to feel pain and then be susceptible to prey coming from somebody killing us with a bird in the wilderness, or
right.
we don't want to be prey, right?
Yeah.
So it's a primitive primal instinct for us to avoid pain, so that we're not subject to being taken. So
it's like a checkpoint, like stop doing this.
So if we can influence the body or the nervous system to start moving again under the duress of this type of natural, because our body's nervous system is a DC, like this is a direct current, like TENS machines, Dr. Ho machines, those are AC currents. They have their place for pain control, but they're counterintuitive as far as movement patterns, because you're flip-flopping this positive and negative current.
Okay.
And it's like relax, contract, relax, contract. Well, how does that change you, so to speak, right? But if you can actually move fluidly under the duress of this, the brain starts going, oh, I can do that. Like it's actually safe for me to do that again. So it's a really cool. And the reason I got into it is I had a hip procedure just before COVID, and I needed to get back to work as fast as possible. So, researched some of what else can I do that's latest and greatest. And I found this type of therapy, and I was all in. I went down to Texas, trained on it, brought my staff down. We all trained on it. And we brought it back here, and we were the first clinic in Canada that used it.
Wow.
And we helped them get Health Canada approved, because at first we couldn't use it in Canada with patients because it wasn't Health Canada approved, but we kind of connected them with the right people, so it was able to be Health Canada approved.
Amazing.
And it's honestly, it's been one of those clinic changing type of therapies, because patients kind of leave there and go, oh, don't take it off. Like it feels so good. I can move with it on.
Wow.
I'm like, okay, well, we want you to keep moving with it on, and your brain will start to learn those. So it's really cool.
Oh, it's cool.
I have, again, there's so much theory that I can get into with this that I think would be way out of the scope of this podcast, but it's one of the things that I like to do that excites. It's one of the, so what excites me to keep going to work all the time? Like I have to kind of evolve and change. Like I don't want to be, how wrong would it be to be, or my staff or to the patients, for me to be the same chiropractor I was 25 years ago? That would be, it's boring.
I think that's why we're so adamant with our like various colleges to do the continuing education, 100%. Right? Like we want to stay on top of things, and I think it's really important for people to know what options are out there.
Absolutely.
That it's not just, you're not, I think like when people think of a chiropractor, they just think of like being cracked, right? But there's so many mechanisms now that can like help in their recovery. So absolutely. I think it's important to know.
And I think it's getting better where, there's still many that still think that's what we do. But I think the evolution of what we do, chiropractors, physiotherapists, like there's so much overlap that the public knowledge, the medical world's knowledge, they know we're not just doing the same thing over and over again and repeating and hoping for a better result. Like that would be
Yeah. That's literally the definition of insanity.
Yeah, like it's not working. You got to go back and that's where our training comes in. Okay, like maybe something else is going on. Is it worth a referral elsewhere? Is it worth a different set of eyes? Like,
for sure.
Simply, it's a little bit more than a regular chiro visit, but it's time. Like you're there for a lot longer, almost double the visit time.
Okay.
I usually use an assistant to help me the machine, but that's irrelevant. It's always about making the decision in the patient's best interest.
Yeah,
so
just giving them
there's
opportunities
times when it's not
like
the
this.
right thing to do. Like sometimes you really have to start slowly. So but the reason I bring it up is not to kind of promote it. It's more like to say this is what we do to stay current, to stay different, and to keep evolving.
Oh, this is the opportunities that are out there.
That's a good pun there, stay current.
Yeah, stay current with the current. But and then there's something else. There's a whole, and then I have another mission. But like I'm not Dr. Machine either. Like if I'm not using my mitts with you,
Dr. Robotnik.
Yeah, like these hands are still primary, right?
Yeah.
Like I touch them, I touch people, I use my hands for therapy, I maneuver people. The hands don't go by the wayside. I like tech. I use it as an assist. I don't use it as an exclusive. Right?
Totally. I think
it's important that I say that too.
I've read so much about also with like physiotherapists and also with massage therapists of just having this like intuitive nature, right? Where they put their hands on someone and they can like, people describe it as having this like intuitive nature of their patients, which I think is, it's where that crosses over into the, It's
so true. You start to gain patterns with patients, but I think back to even like, so I get excited now. Like I love what I do. The passion kicks in, but I think back to, I don't know, a year and a half into my schooling and getting in, they were like, okay, if you put your hands on and just feel, and the whole class is going, you can't feel that.
What do you feel? Yeah.
But it becomes such an appreciated skill over time, over, thousands of people. And you go, like, oh yeah, I can. Okay. Because then you can start to make comparisons of this person to that person.
I was going to say, you're your own research model.
Yeah,
you're like,
really
I've seen like 50-year-old ladies like this, and there's
exactly. This
feeling,
is what we
right?
would expect. And you're not like that. But oh my God, we would laugh in school. Like, yeah, right.
Yeah.
You can't feel that.
Yeah. What are you, psychic?
Yeah. Like, you could tell me anything. I'm like, and I could, but I wouldn't.
No,
like,
I think it's,
that's where you gotta trust the person you're seeing, right?
I think it comes back to that intuitive nature of like, the client, understanding your clients, which is cool. And I think experience too. That's why I like,
100%.
Going to clinicians that are experienced, I think anytime they come with that like body of knowledge of, all the past clients they've ever worked with, which I think is really awesome.
Absolutely.
So that is a perfect prelude because I did want to talk about just kind of like long-term how people should, use intentional movement in their daily life. What should like a typical, a movement schedule look like for somebody who wants to maintain their health and doesn't want to deal with mobility issues?
It's a really good question. But a really simple answer too. Like if you can't walk, then what can you do? Like if like, the first walk, like that would be the first thing that anybody should be able to do,
right?
Because it's a very, it's a primal movement pattern, right? Like
it sounds easy, but we're becoming more and more sedentary, where people are just like, I'm going to drive to the corner store. It's 3 steps away.
For sure. And it's easy to do because you just turn push the button on the car now
we're all
and
in a
drive
rush.
and go.
Yeah.
But, it's one of the things that, if you can't walk, then, you're already behind the 8 ball, right?
Yeah.
Like you're starting to struggle and, what's next? If you can't walk, usually, your hips or knees are a problem, then your back becomes a problem. then, the shoulders, then it becomes a snowball because walking is how we get around, right? Like if you don't have a car, you walk, riding a bike, sure. But that's not the topic. Like the conversation is what is your movement patterns, and that would be the first thing I would make any goal to be of a patient is to try and be able to walk, right? Yeah, that would be number one.
And I've even had clients over the years, like I'll say to them, like if it's too painful, walk in a pool.
Absolutely,
go in the pool because you have the buoyancy, right?
I can't think, and I'm sure maybe I'm wrong, so don't I'm not writing this in stone, but I can't think of anything where a pool or a weightless environment would not be helpful for initiating movement patterns. Obviously you want to induce weight bearing under gravitational forces for bone density and muscle strength and all that. But movement patterns, if you can't do it under the duress of gravity, then a pool would be the next logical step, right?
Yeah.
So that you can try to develop that, because you can hold a floaty and move your legs, right?
Yeah.
As long as you can move your legs, but if you can't, you probably shouldn't be in the pool.
Yeah.
Right? So that would
Even
be number
that though,
one.
I'll like put them in a floaty and get them moving their arms.
Well, you do get resistance, right? Like what you push is what you get back.
Yeah.
You know, the oppositional forces of the water. But we've even come a long way with technological advancement, like with our wearables and watches telling you to stand up, to move, to walk. And you can change that. Like, okay, if you don't want to get up every 10 minutes because it interferes with your thought patterns, set it for a half an hour.
Yeah.
But when you think of perfect examples, think of, you know, we're probably all old enough here. You wake up in the morning, you're like, oh, that's stiff. That hurts a little bit. You know, probably didn't feel that way when you were 12. But it does now, but because we're stagnant, so we're in what's called the sleep tone. So our joints aren't moving, right?
Right.
And when we move, we pump the joint fluid around, and it starts to lubricate the joints, and it starts to feel better it feels better as I keep moving around. The day goes on.
Yeah.
Same thing. If you sit at your desk for 8 hours without moving, the same thing's going to happen. You're going to get up and you'll be like, oh man, my back hurts, my knees hurt, my hip hurts. But if you get up every once in a while, you don't let your body go into that position to kind of just settle, so to speak. So the joint fluid is it's constantly lubricating the joints because it pumps in and out all day long as we move.
Yeah.
So, even if it's, I've had patients ask me, can I get one of those little QB things that I put under my desk, those little cycle? Absolutely.
Yes.
Move your knees.
Anything
move your
that works
hips.
for you.
If that's what works for you,
Yeah.
it's better than doing nothing.
Totally.
Right? So movement matters. And
if
you don't move, then, it is a move it or lose it. Motion is lotion, whatever adage you want to say, or kind of, saying you want to put out there. It's the truth.
Yeah.
It's
for
true.
so many reasons. It's not just the mobility, but it's also, your cardiovascular and all the things,
Absolutely.
right? Like you're not going to be healing as fast if you're not moving.
Correct.
And then, I guess my plug is always for yoga.
I would tell, I'm a big fan of yoga.
Yeah.
I think yoga is one of the safest things you could do.
Totally.
Even when you're in, like, there are times when you have to progress, for sure.
Yeah.
Like, I have to be careful with how many absolutes I give, but I like yoga because your body weight is your resistance.
Totally.
Right? So the resistance that you should be able to maintain or work with your body weight.
Yeah.
Right. So
you should always be able to lift your own arms and your own legs.
So
yeah.
that's what I really like. I really like yoga in that
And I love that
too.
It's like a check-in. Like you're moving so slowly that you're able to like kind of check in. You're slow enough that you're like, oh, how does this feel? How does this position feel? Right.
Yeah. So. And there's some schools of thought, should you do that much forward bending if you have a disc injury in your back? And here's the answer is you should be able to, maybe not in that way yet, but the progressive, nature of it, nobody can just start doing the most difficult positions or maneuvers, right? You have to progress even in that. So do what you can.
Yeah.
As your body there's the word again, adapt and change, you will get there, right?
Yeah.
Like that will happen over time. So I'm all in on
Full
yoga.
on yoga.
I'm all in on yoga.
I think yoga is like a nice, like you kind of mentioned, is like it's a goal setting too for people, right? Because it's not like, we could do the same thing. Like I'm going to run for 5 minutes. I'm going to run for 6 minutes. I'm going to run for 7 minutes. But I think with yoga, it's really nice because you really feel the difference. You're like, I could only get my arm to here, but like, look, now I can get my arm to here.
Absolutely.
So it's such like a great check-in of a range of motion.
But you're also using breathing patterns. And I think people don't realize what their breathing patterns do to
power.
To what they
system.
do. Absolutely.
Yeah.
And where you can play on that autonomic nervous system, like that nervous system that you can't conscientiously control.
Yeah.
That rest and relax, or that fight and flight. Your breathing patterns, they can dictate so much.
Yeah.
So, one of the most basic things anybody can do when they're in that state of, like, think of, I don't know if you've ever had it, but if you can think of anybody who's ever been in like significant low back pain, like where they can't get out of bed, well, okay, maybe you can't walk yet, or you can't, but breathe. Like, how can we get your nervous system to kind of down regulate a little bit, bring you back down to a little bit more of a, what we call a higher parasympathetic tone, but something that's more relaxed, something that's just a little bit more calming, so that you can prepare your body for the next step, or even just to get some sleep.
Yeah.
Right. Like, because it's not always about taking something to fall asleep, because that's still, even if it's a magnesium, it's still not like we're still relying on
Yeah,
something.
it's still supplemental.
Right?
Yeah,
Right?
it's still
Like, as much
supplemental.
as it's safe, you know, it's nice not to have to rely on that to you know, try and go to sleep on your own. But that, again, whole other conversation.
Yeah.
But
No, I
but
love
breathing patterns, yoga, this is where we were at.
Yeah.
And I think that
It's crazy that, I mean, you're a parent too. Your kids are a little bit older, but isn't it like insane that it seems so like innate to us to get worked up where we can't breathe?
100%.
It's so wild that it's in us naturally.
Oh man, I'm so guilty of it too. Like extremely guilty of it actually. And
you're a business owner.
And then yeah,
Panic mode.
But it is. It's kind of how we live, right?
I
We're
know,
racing to the next event,
hate it.
to the next, even by the virtue of what I do, the next appointment, right?
Yeah.
Like, but you know, you got to get the kids to work, you got to get the kids to school.
Yes.
But
yes.
and so I shouldn't just say kids. It's just even my own schedule because people who don't have kids have this problem,
Right?
Yeah.
Where they're
Your
always
body
racing
thinks
against
you're
the
getting
clock.
chased by a bear.
Yeah, and that's not good on our nervous systems.
I know.
That is
I
fight
know.
and flight all the time.
Yeah.
You know, and
Yeah.
that's hard, but it's the world. Part of it is the world we live in, but the other is it's the world we create.
Yeah.
Because how many times do you take a step back and you go like, oh man, I wish I
Just
would have
breathe
just.
for a second.
I just wish I would have maybe not done that, or just maybe thought it out through a little bit more before I committed to it. You know, and
Yeah.
but I mean that's a life experience,
Yeah,
right? So
yeah.
it's hard to say you have regrets, but it's hard to it's just hindsight is always 20/20. But
Yeah.
breathe.
Yeah, and I think that comes back to
Slowly.
like the holistic
Yeah.
learning,
Yeah.
right? Holistic
Yeah.
practices, because like
Yeah.
we used to. I lived in Korea for a couple of years, and this is like they
cool.
teach this to like babies.
Yeah,
Babies are sitting there, we're gonna have breathing 5 minutes, you know, and they teach them.
because it matters.
And they teach them
Yeah.
how to like, you know, relax and calm themselves down. And I think they're trying to use it as like a teaching tactic.
Right.
Because they don't want the tantrums and the blow ups and whatever. But I'm like, oh, if we could just could have gone back to our child's self and learned how to like
Right.
use some of this breathing pattern in our, you know, our day to day. It would have been,
absolutely.
we would be a lot better for it.
Yeah, no, absolutely.
We want to take a break?
Yeah, sure. All right, we'll be back.
We'll be
knows your
back.
cues.
Yeah. Back today. We're hanging out with Ernie Bagnulo. He is the founder and owner of Win Health Niagara here in Niagara Falls. And as we were just having a nice chat about his clinic, all the different things about chiropractic practices. Now we're gonna kind of switch gears a little bit because same as me, you know, we're doing our craft and we're doing our art and we're doing our profession, but we're also simultaneously running a community and gathering people together. And I think I'm giving more and more credit to how powerful that is and how, what an honor it is that you get to do this. And I think none of us think about it when we're just grinding at the beginning of our business, but we do at some point get to look back and be like, oh my God, look at this beautiful community that I'm creating.
Yeah.
And how powerful that is. So yeah, kind of how does that feel today? You being able to look at you just got into a new building and you have all these practitioners, you have all these clients. So how does that feel kind of hovering over a community like this? That's a really surrounding wellness.
Yeah, it's proud. I'm proud for sure. Yeah. It would be, I'd be lying if I told you I wasn't. I care about the patients. I care about the staff, but I joke. Sometimes people come into the clinic and they'll, someone will walk by and be like, "Hey, how are you? How are you?" And it's like cheers in here. Everybody knows everybody's name, right? Like it's the patients know who they're seeing at the front desk. They know who the practitioners are. So there's a lot of overlap with patients and practitioners together too. So when for example, if someone's seeing practitioner A, they know that practitioner B is a physiotherapist, and they'll say something like, "Oh, can I see so-and-so too?" And then the collaborative effort starts. And then all of a sudden they've become part of we call them our Win community, so to speak, where, then all of a sudden they see the naturopath, and, we're doing different therapies even on the naturopathic level, but the roundabout and the way that people interact with the therapists and the staff. And I've had staff sit down with patients and show them pictures of their children and their grandchildren, and staff who does the same to us. Like sometimes we're just about to walk out of a room and staff is like, okay, I got to show you this picture of my son's wedding or something like that. So you do become part of their extended family, and you do learn about their family, and you do learn about what they love to do, and some of the little nuances of their life. So running a clinic like this is absolutely family and community, and we like to include the community outside of where we are too, right? Like try to give back a little bit, whether it's charitable causes, donations, drives, whatever it might be. We try to always stay involved with some of those local organizations too, and I think that's important because you have to give back. We always keep a little bit every little bit. We always, every once in a while we do something to give back to the programs or communities that need help. But I mean, we've built a community of like-minded practitioners and like-minded clinicians or patients who really kind of subscribe to what we preach, and that's what's important.
Yeah, we were talking on the break, just kind of have a that not sentiment, but the experience of trying to go out into the community, and how, there's lots of times that I feel like I'm a celebrity. I'm like, I have to like do my hair. I know I'm going to the grocery store, but I'm going to see someone I know.
Oh yeah, absolutely. It's like, you can't go out, or you have to pick certain times.
Yeah.
But you know what? The truth is, I love it.
I know. You're a local legend, right? Get the queen wave.
I would be absolutely lying to you if I said, I duck.
Yeah.
Because I like seeing people. Like I'm a social person, and I enjoy that kind of talking and collaborative. And I think that's part of what's made success come through, right?
100%.
Like, I'm not saying, I'm not saying that if you're not like I am, there's something wrong with you. I'm just saying that this is who I am, and I'm comfortable in that skin. I know what I like, and I know what makes me happy. And you know what? I like seeing people. I like talking to people. I think it's fun, and life to me would be boring otherwise. But it does drive my wife nuts. That takes me, a long time to do groceries if I go. Or, where she's like, I don't understand. I can do it in like 25 minutes.
Yeah.
But
you're like, well, I had to talk to 10 people.
Yeah.
So
Yeah. I mean, this is where I was born and raised. So, that alone is blessing and a curse, right? Like
what
blessing.
school did you go to?
I went to St. Paul for high school.
Okay. I went to St. Mike's.
Did you? Okay.
Yeah.
Rivalry.
Yeah.
But yeah, we, so being from Niagara has been, I've been privileged to give back to the community and help the community that essentially raised me, whether it's sports, schools, teachers, whatever it might be. And, and I'm proud to do so. When I say curse, I shouldn't, maybe a wrong word, but I said that in the sense of like, I put this pressure on myself because, oh my God, I have to help so many people because I know them or they helped me, and I don't want to disappoint them. But that's what I mean by curse, not because I regret living. I'm very happy to be where I am.
Yeah.
And I'm happy that it's a great place to live. Niagara is a good place to live. I'm happy to call it home. And
yeah, we've both done some traveling and ended up coming back here. But yeah, I think it's a natural experience as a leader to constantly, it's like that, it's like a father figure, right? You're always trying to like help everyone and protect and lead. We were talking last week with one of our guests as well. And yeah, I think it's a lot of pressure, but it's a beautiful pressure. Yeah,
absolutely.
Kind of
it's
being
beautiful pressure.
Yeah, being
right?
the proctor.
Yeah, that's absolutely. Yeah.
Yeah. And I will say, I think that really does, like, you can speak to this, but I think that is what sets WIN apart is, I mean, obviously going into the building, it's beautiful. Like, it's just the most like calming and, everything, all the decisions that you've made to the actual atmosphere is amazing. But yeah, it was definitely, when I was in there, it was just like the back and forth, right? The like people hanging out in the lobby and talking to the front desk staff and just the flow of the building, I think is really what connects it. It's the connection that the clients are having with the practitioners in the building.
I appreciate that. Thank you.
Yeah,
it's important. I mean,
it's incrediable.
We've put a lot of effort into how it looks because I think that does matter. I mean,
100%.
Yes, the product matters, but I think, nobody wants to see dust bunnies in a corner.
No.
And I think if you care about how you present, you probably care about how you practice too, right?
100%.
I think that's so it's not just a false facade. It's certainly something that goes into to how we operate on a daily basis too.
Yeah.
So,
It's like detail oriented.
absolutely.
Yeah.
Absolutely.
What advice do you have for someone either starting just their own health journey, or maybe, like similar to what you have accomplished in terms of your business journey?
Let's see. No, not at all. It's so.
No, I think it's we need to be honest about the amount of work.
It's a lot of work. I think that's would be my advice: is be prepared for stress, be prepared for failure, be prepared for upsetting people, be prepared for looking yourself in the mirror and saying, "Am I doing the right thing?"
Yeah.
And then also be prepared to pat yourself on the back, to reward yourself with some affirmation, to understand that it's a process. Like, so those cliches, so many of those cliche phrases, it's a journey, and it is. It really is. And, this is a small business. Like, this isn't a grandiose corporation.
Yeah.
I'm heavily involved in the daily operations, maybe too much, but it's because I care.
Yeah.
But it's such a reward at the end of the day. I wouldn't have changed it for anything. I'm so glad that I was able to not just help patients, but to help people who've worked with us over the years. I've created
your
relationships,
team, giving those opportunities.
And even those are the ones that aren't around with us anymore for whatever reason it may be. Like, they've all shaped or been a part of kind of the DNA of the clinic in some way.
Totally.
And I don't have any bad things to say. Like, I harbor no
all joy.
Yeah. At the end of the day, you have to be able to see the big picture.
Yeah.
And I think that's super important in any business. But it is a business for sure. You got to pay the bills, and there are certain overhead costs that are there that are unavoidable.
Yeah.
But it doesn't factor in my decision making over what we choose to do with patients, right?
Yeah, I always try to explain that to people in the studio too. I'm like,
will come.
Yeah, and like it obviously has to steer our like finances, but like finances are different than your business. Like, I don't think about finances. I think about how I'm going to like create a system or create a situation that's the best for my client.
Absolutely.
Yeah.
You have to be responsible in your decision making.
Yeah.
And sometimes they're not easy decisions to make.
No.
But I'm not comfortable sitting here talking about like or giving business advice, because I've got a lot of regrets and failures in that regard where I've been like, oh,
why did I do that?
No, not why did I do that, but just, I wish, or more like I wish I could.
Yeah.
Or I wish I did, rather than why did I?
Right.
But I don't know if this is, healthcare specific, but I think if I were to spin it in healthcare specific, if someone's, prepared for advice, just, you have to be prepared to, we go to school. And, anybody in, whether it's med school, physiotherapy, chiropractic, I can't think of many that go to school think, I want to run a business. And we go there thinking, I want to help people. I want to learn how to help them get to be the better version of themselves. I want them to help them get stronger, rehab, get out of pain. Like, all those pure intentions are there.
Yeah.
And if that's lost somewhere, or if you're not capable of doing it anymore, work's gonna suck.
Yeah.
That's where. So
you gotta keep the passion.
Yeah, I think it's important to still maintain that, or just be the administrator.
Yeah.
And just say I'm good at just being the administrator now.
Yeah.
Like, that part of me is, look at yourself in the mirror and say, okay, like, I'm not capable of being that person I thought I could be, when I was in school.
Yeah. That's me. I was, I was a dance teacher for 15 years, and now I've kind of stepped back and gone like, I've lost the, obviously if somebody was like, choreograph this dance, I could do it. But I think you do sometimes graduate out, and then again, you end up being a facilitator for everybody else that's practicing. Sure. Right. So I think no matter where you are in your business, it's nice you just have to stay hungry and passionate.
Yeah. Do you see yourself doing that one day?
What's that?
Stepping back, just being the administrator?
It's not the first time I've been asked. Not entirely. I don't think I could ever really stop. I love it too much. Like, I do enjoy it, and I think I have a lot to offer. Like, if there comes a time when I'm physically incapable, heaven forbid, but that might factor into it. But I'm not sure I could ever pull away entirely, because I know I wouldn't be happy.
Yeah.
Like that's not where I would be happiest.
Yeah.
So that's how I'm going to answer that question, because that is the truth. I mean, I could certainly see
Not in the
myself
foreseeable future.
working less hours for sure. But, there's also going to, like, I already see it, right? Like, I'm in my late 40s and I'm not the new fresh young guy anymore, right? So there's a new wave that comes in, and my role is to mentor and teach them and kind of give them what I know.
Yeah.
And let them kind of move on to the next, phase, so to speak. But, I'm not ready to give it up, but I also will learn with them. Like, I embrace newness.
Yeah.
For
So
sure.
awesome. All right. Well, tell us how they can get involved. If listeners are trying to connect with you, where can they find you?
So clinic website is probably a really good resource. It's
we'll post it on the bottom of the
winhealth.ca. So www.winhealth.ca. Info@winhealth.ca is our email address. Clinic is at 4114 Portage Road in Niagara Falls. And phone number is 905-354-8397. Very good ways. Those are the easiest ways to get a hold and have the availability. I mean, we have a presence on social media as well. We have a Facebook page, we have Instagram.
Amazing.
So those are good ways to kind of, get in touch with us too. It's still healthcare. So we walk a line we use social media to kind of promote and show what's out there. I'm always careful on that being our communication tool, because I don't know who's on the other end. Right. And I'm not sure, health advice should not, random cold calls is not where I want to be giving health advice.
I was going to say, do people need a referral to get to you?
No. Okay. So that's really good to know. Like there are no instances. So chiropractors are considered portal of entry. So we don't need referrals.
Perfect.
Physiotherapists are now considered portal of entry. So no referrals, naturopaths as well. Some massage therapy plans would still require doctor's notes for requisitions to get covered under extended health benefits. Okay. If there's no extended health benefits, then there would be no reason for a referral in any capacity.
Amazing.
We'd be able to bring them right in and be part of our team.
Amazing.
Of wonderful patients.
Yeah. Awesome. Well, definitely we'll check it out, and definitely all our listeners for sure, check out Win Health.
Absolutely. And we're a team, right? Like I'm one person, so I always want to just kind of give props to my team as well, because they are they're very capable and well-trained physiotherapists, chiropractors, naturopaths, massage therapists. We all collaborate at all times. So I definitely want to ensure that they get the kudos for their good work.
They get their notice too. We'd love to have them on the podcast.
Absolutely. I think we should try and figure something else.
Let's keep doing our wellness. That was definitely one of our goals for 2026 was more wellness. So
we'd love to
have your staff
to collaborate before we kind of make that into
motion and lotion. Motion and lotion.
I love it. We've already got a name. I want to thank you both for having me too. I had a really good time. This was a lot of fun. You guys have both been great and so hospitable. I really appreciate you both for having me and letting us use your parking lot. For sure. Thank you. I appreciate it.
Don't forget to follow us on Spotify, and you'll never miss a podcast.
All right. Good night.